Hello everyone. So in this video today I will be talking about alternative routes of medication in homeopathy for palliative care patients. I will be talking about homeopathy, its role in palliative care, and some routes of medication in homeopathy for the palliative care patients. So, homeopathy is an alternative system of medicinal therapeutics discovered by Dr. Christian Friedrich Samuel Hahnemann in 1796. It is based upon the principle of similia similibus cudenter, which means let likes be cured by likes. This signifies that a remedy selected for the treatment of a natural disease shall be the one that is capable of producing a range of similar symptoms in a healthy person. The administration of medicines in homeopathy is governed by three basic principles: the law of similia, the law of simplex, and the law of minimum. Law of similia states that the medicine should be employed on the basis of similarity of symptoms. The law of simplex states that only one single, simple homeopathic medicine should be administered at a time, and the law of minimum states that only very minimum amount of medication should be given to elicit a response. This minimum dose avoids any unwanted aggravation and also ensures that no damage occurs to any vital organ of the body, thereby preventing any risk of drug effects or drug addiction. In homeopathy, we adopt a holistic care for treatment. The medicines help to fight against diseases by assisting the body's natural ability to provide relief of symptoms for the illness, rather than suppressing the symptoms. This therapy adopts an individualistic and holistic approach. A homeopathic doctor does not treat in the name of the disease. Rather, the treatment is targeted against the patient who is suffering from a particular disease. Now we talk about role of homeopathy in palliative care. Palliative care is required for the patients with chronic diseases, patients with cancer, patients having chronic cardiac disease, having COPDs, having kidney failure, AIDS, Alzheimer, and neurological conditions like multiple sclerosis, amyotrophic lateral sclerosis, and many other serious illnesses. The role of homeopathy in palliative care is very significant. Homeopathy adopts a symptomatic treatment. Using these medicines for palliative care, specifically for pain relief, is very safe and free from side effects. Homeopathic medicines have no side effects even on long-term use. Single remedy in potentized form is employed on the basis of law of similia for the palliation purposes of incurable states. In cases where pathology is so much advanced so as to become irreversible, homeopathic medicines can provide a great soothing effect. Homeopathic treatment is based on observing physical symptoms, mental symptoms, and peculiar symptoms. Homeopathy has a positive role in improving the quality of life also for the patients having incurable chronic diseases like cancer, HIV/AIDS, terminally ill patients, and incapacitating diseases like rheumatoid arthritis, etc. Medicines can be given for common symptoms in the dying patient like nausea, difficult breathing, excessive secretions and death rattle, insomnia, pain, and emotional upsets like fear, grief, and anxiety. Integrating homeopathic medicine treatment can also reduce the amount of pharmaceutical drugging. This is possible if a family member or friend is willing to administer the dose of remedies, observes the results, and reports to the homeopath regularly. Now, although every dying person will have different symptoms and different needs, so the family can keep their loved one more comfortable and go through the stages of the dying process in a more holistic and conscious manner using homeopathic remedies. A motivated family can take charge and integrate customized palliative treatment using homeopathy into the care plan, which will allow the dying person to need less drugging, and homeopathic alternatives to symptom suppression using drugs can be found for almost every situation. Homeopathic medicines do not interact with drug treatment. This is a real plus, and so they can be easily integrated with allopathic medical regimens also. Homeopathy should be offered as a modality option from all hospices. Conditions where palliation is used in homeopathy. So, this can be done in cases of incurable cases. Here also, the basis of law of cure is the fundamental law of similars only. This law is useful and used as the basis of cure for incurable cases also where palliation is required. In advanced cases with irreversible pathological changes, administration of a similar remedy ameliorates the situation, and it does that for few days or for a longer period also. Then after that, if there is a return of symptoms, then again the indicated remedy will be repeated. Thus, the patients can be made much more comfortable. In cases of insomnia, homeopathy can be used very much effectively, and it can be treated with crude palliative measures so that the patient secures sleep. If insomnia is considered as a part of his symptomatic picture and given its proper place in that symptomatology, and the man himself is treated, not alone one or two symptoms, he will gain his natural refreshing sleep, and he himself will be improved in general health. When there is pain and we have the symptom to be complete, including its location, type, aggravation, amelioration, and concomitants. In that case also, a carefully selected remedy will relieve the pain promptly, and the patient will be much more comfortable and happy in general than any narcotic. Homeopathy can be used in surgical cases also. It can act as a substitute for narcotics in surgical cases either before or after the operation. Here the indicated remedy does excellent service, and the patient will go through the mental and physical distress very happily. These remedies will be indicated partly by the symptomatology of the patient and partly by the immediate causes of distress such as lacerated wounds, strenuous vomiting, shock, and incarcerated flatus. So, to summarize, we can say that for palliation purposes also the same law applies in curable and incurable cases, either for palliation of incurable diseases or for the cure of curable diseases. The symptomatology of the remedy must simulate, in so far as possible, the disease picture in order to bring relief. In cases of incurable cases or seemingly incurable cases, the simillimum will also completely meet the situation and obliterate the symptomatology and restore the patient to health. Now we talk about administration of homeopathic medicines. So, as we know briefly that the preparation of the homeopathic medicines is done from substances of animal, plant and mineral kingdoms and other natural substances. This is done through the process of dynamization or potentization. Potentization means a serial dilution and succussion process which helps to raise the inherent curative power of the drugs to the maximum, as you see in these pictures also, the process of succussion and the process of trituration. These both methods help in potentization. Now, the more times this process of dilution and succussion is performed, the greater potency of the remedy will be and lesser will be the concentration or of active ingredient in the finished product. Through these processes, the potential of the medicines to combat the ailments is enhanced and also toxicity is reduced. Homeopathic medicines are commonly administered in the form of liquid, medicinal globules, topical products, powder or tablets. There are even homeopathic medicines prepared as syrups, lozenges, eye drops, medicated powders, capsules, etc. Alcohol is an excellent preservative and vehicle for homeopathic medicines. Now we talk about the routes of administration. The usual mode of administration is through the oral route. But if the patient is very sick and having gross pathology and is a palliative care patient, then alternative routes can also be adopted as per the requirement, such as olfaction route, which is inhalation through the nose or mouth, application to the skin mode, application of medicine through the milk of the mother or wet nurse, through eye, ears, etc. Now, this slide summarizes all the 5 modes of administration of the medicines. That is oral route through ingestion, through the mouth, olfaction, inhalation, through the nose or the mouth, then application to the skin by rubbing. Now, then application of medicine through milk of mother or wet nurse and others like eye drops, ear drops, etc. Now we will talk about these in a little more detail. So we discuss about each of these modes. First we talk about the oral route. Now by oral route, medicines act effectively and promptly. Homeopathic potentized medicines require no digestion but get absorbed directly from the mouth and then act through the cerebrospinal or ganglionic nervous system. And for an enhanced effect, the medicine must be administered after being dissolved in greater quantity of liquid, which acts as a vehicle, which will be water, so that it comes in contact with much larger surface of the sensitive nerves. Medicine can be dissolved in water like a single globule, which can be crushed with sugar of milk and dissolved in some water and stirred well and then administered. This will be even more powerful. The greater the quantity of fluid in which it is dissolved, the better will be its effect, because in this case, medicine will come into contact with a much larger surface of sensitive nerves responsive to the medicinal action. Now, it is recommended to avoid touching the homeopathic globules and tablets with fingers or hands. The easiest way is to gently shake the required globule or tablets into a cap of the container and use that as a cup to gently place the medicine in the mouth, as you can see in the picture given over this slide. Now this should be done because homeopathic medicine is thinly absorbed onto the surface of the globules. So any moisture on the fingers or hands may release the medicine at the point of contact rather than in the mouth. Now in addition, any oils on the skin may stick on the surface of the pellets or tablets and can impede the proper absorption once the medicine is in the mouth. So it's better not to touch them and just put them in the cap and take them. Now for better buccal absorption, it is generally suggested that homeopathic medicines be taken with a clean mouth away from strong flavors. They are typically taken on an empty stomach unless otherwise indicated. Now oral route. Another way of oral route is sublingual administration, that is, letting a pellet or tablet dissolve under the tongue rather than chewing it. Then medicine in this way can be administered for local action like gargles. Now, homeopathic medicines should be placed under the tongue of adults and children or in the cheek of an infant where they will be dissolved most instantly. Now, medicines can be administered in solid form and liquid form orally. In solid form, they can be given in the form of globules, sugar of milk or tablets, and in liquid form, they can be administered after being dissolved in some quantity of liquid vehicle so that it comes in contact with much larger surface of the sensitive nerves. Potencies are selected as per the condition of the person or patient. Second is the olfaction mode. Olfaction means the act of smelling. It is a method of administering the medicine to a patient through the nose and mouth by the act of smelling. Master Hahnemann was administering medicines by oral routes for many years, but in his last years, he favored the olfactory route also. In this method, the globules are moistened with the medicinal fluid and placed dry in a small phial. Then the patient is allowed to hold the open mouth of the phial first in one nostril and in the act of inspiration draw the air out of it into himself. If it is wished to give a stronger dose, then the patient is asked to inhale the same vapor with the other nostril more or less strongly according to the strength intended to be given. As you can see in the picture that how this method can be used. Then if it is wished to give a stronger dose, the patient is asked to inhale the same vapor with the other nostril more or less strongly according to the strength intended to be given. Now if both the nostrils are stopped in cases of coryza or polypus, then the patient should inhale by the mouth, holding the orifice of the phial in between two lips. In cases of children, this phial can be applied close to their nostrils while they are asleep with the certainty of producing an effect. This will surely produce an effect. The medicinal aura, thus inhaled, comes in contact with the nerves in the walls of the spacious cavities and thus produces a salutary influence on the vital force in the mildest yet most powerful manner. The interval of repeating the olfaction should be the same as that of the oral route. This method is useful in most sensitive patients and for the patients having most acute complaints. Now, specifically, this method can be used for idiosyncratic patients or when it is not possible to give the medicine through the mouth, like in cases of fit or epilepsy or hysteria or lockjaw of tetanus. Another method is application to the skin. Here, the topical products are applied directly to the skin to stimulate a localized healing process. This can be done using glycerols, ointments, liniments, opodeldocs, lotions, cerates, poultices, fomentations, plasters, sprays, oils, etc. This is done by rubbing or friction, where the medicine is applied by friction through the whole cutaneous surface of the body wherever the epidermis is sound, such as on epigastrium, inner parts of the thighs, lower part of the abdomen, back, arms, legs, testicles, labia majora, etc. Here you can use lotions, ointments, liniments over the unbroken skin. Then another way of application to the skin is the anepidermic route. In this method, drugs are simply kept in contact with the unbroken skin without friction or rubbing. Examples: plaster, poultices, ointments can be applied in this manner. So, various external applications are glycerols, ointments, liniments, opodeldocs, lotions, cerates, poultices, fomentations, plasters, oils, injections, surgical dressings. Now, another method is through the milk of the mother or wet nurse. Now, this is a great way of application and which has a great scope in homeopathy. Homeopathy has a great scope for administration of the medicines to the infants. For treating the ailments of an infant, the medicines are administered in moderate doses to the nursing mother. This medicine can be easily and certainly used by the child through the milk of the mother. Every rightly chosen medicine administered in this way removes the ailments of the infants. This method of administration is very peculiar and important in homeopathic method of treatment. Now other routes are like eye drops or as ear drops. In eye drops, Cinerea meritama succus, and in ear drops, valerian oil are the examples. Now few precautions which can be followed generally while administration of the homeopathic remedies are like it is preferable to take any homeopathic medicine apart from the meals, like nothing should be taken half hour at least before or after taking the medicine, and it is recommended to refrain from taking the homeopathic medicine at the same moment as other medicines and supplements so the two do not interfere with each other. So an easy to follow rule will be to simply wait 15 minutes to half hour before or after taking the other products. It is recommended to refrain from consuming foods or drinks that contain aromatics or stimulants such as coffee and peppermint at the same moment as when the homeopathic medicine is being taken so that the two do not interfere with each other. Here also the easy to follow rule is to simply wait 15 minutes to half hour before or after eating, drinking or brushing the teeth. Now everything which can hinder the medicinal action of the medicine should also be removed from the diet and regimen of the patient during its administration. No new habits or addiction should be indulged during the taking of the medicine, and all emotional stress and strains and excitements should also be avoided. To conclude, I will just say that homeopathic medicines are palatable, have almost no adverse side effects, and can be administered easily. Homeopathy has been useful in the treatment of psychosomatic disorders, autoimmune diseases, geriatric and pediatric disorders, ailments during pregnancy, obstinate skin diseases, lifestyle disorders, and allergies, etc. It also has a positive role in improving the quality of life in incurable chronic diseases like cancer, HIV/AIDS, terminally ill patients, and incapacitating diseases like rheumatoid arthritis, etc. So its popularity is gaining momentum all over the world. So it's a great system and very useful for the palliative care patients. Thank you. I hope you liked my video. If you like that, then do like, share and subscribe it. Thank you.